Selumetinib in children with inoperable plexiform neurofibroma. Definition: Selumetinib is a drug that was discovered by Array Biopharma and licensed by AstraZeneca. It is being investigated for the treatment of various types of cancer, such as non-small cell lung cancer and thyroid cancer.
The first good news was that we actually saw tumor shrinkage in almost every every patient that we enrolled. And this shrinkage was not dramatic and large in most patients, but it was measurable. And this is something we had never seen before. And what is important here is that we treat young patients, and most of these patients have tumors that are growing. And so even if we see shrinkage that is minor, what that implies is that we don't see growth. And in my mind, stopping a tumor from growing in and of itself could be benefit because we prevent complications that may happen.
Application in nursing. The nursing staff should access the patient prior the administration of this drug, apply the correct file in the administration medication record, and analyze the patient's evaluation.
Onc Live Insights is a video editorial program produced by Onc Live.
So also of interest is combining other agents to tyrosine kinase receptor inhibitors. There was a phase 1/2 study that was presented at ASCO 2015 in which patients received both imatinib combined with a MEK inhibitor known as binimetinib. This was a study that was seeking to determine if patients that were already refractory to imatinib could actually develop some level of efficacy by circumventing resistance induced by the MAP kinase pathway. Patients were essentially enrolled to this study with the primary goal of finding the recommended phase 2.
Pros and cons. Pros: Aglutinib shrink tumor and offer clinical benefit to children with type 1. Improved outcome for children with a genetic disorder called neurofibromatosis type 1. Cons: increased susceptibility to infection, hair loss, arterial hypertension.
I know you have some questions about plexiform neurofibromas. And plexiform neurofibromas are the growths that you can get in neurofibromatosis type 1. And they're different from the skin or cutaneous neurofibromas that anybody can get on their skin. Those are usually small, less than a centimeter, and they're soft, and they never ever turn into a cancer. But plexiform neurofibromas, those are present from birth, and you might not notice them at birth, but they always get very gradually bigger over time. And those do have about a 10% risk of becoming a cancer.
INSEE applied in Ecuador. In Ecuador, since March 2018, 35 children, 70% had a confirmed partial response, less 20% reduction in tumor volume, and most of them maintained this response for more than 1 year.
Hello, in this health sketch we want to talk to you about neurofibromatosis. It's a bit hard to say, but the name makes sense. Neuro means the nerves in the body, while fibromas are the lumps that occur with the condition. There are different types of neurofibromatosis, and in this video, we'll be talking about the most common type, NF1, which approximately 1 in every 2,700 people are born with. It is caused by a change in your genes, which is either inherited from a parent or a new random change in the cells that create a baby. This genetic change causes lumps to grow on the nerves. A number of different criteria are used to help diagnose NF1, and genetic testing may also be used. The most noticeable signs appear on the skin, which might be present at birth or may develop in early childhood. Flat, light brown patches on the skin, called café au lait spots, or CALs, because they are a similar color to milky coffee.
Conclusion: the drug works by blocking a protein called MEK, which is part of the rest signaling pathway, which is overactive in patients with type 1 neurofibromas and causes multiplication of tumors.
Hello. How you doing? There are not a lot of centers that are able to take care of patients across the lifespan with NF1, NF2, and schwannomatosis. So we work very hard to make it possible for them to come to Johns Hopkins and get the kind of comprehensive care that we're able to provide in our NF clinic.
In general terms, the patients who have neurofibromas tend to have multiple. They can have anywhere from a few tumors to literally thousands of tumors in their body. Here at Johns Hopkins, the multidisciplinary group is headed up by Dr. Blakely, who specializes in this type of disorder.
There are actually 3 syndromes that fall under the umbrella term neurofibromatosis. There's neurofibromatosis type 1, neurofibromatosis type 2, and schwannomatosis. The